I'm devising Dr. Digambar slides. So, how many of you want to learn nutritional and metabolic approach to schizophrenia? Raise your right hand. And how many of you don't want to learn this approach for schizophrenia? Raise your left hand. No one? Thank you very much for this. Guys, thank you for being here. Thank you, Dr. Saxena, sir, for giving me this opportunity. I'll try my best to share my all learnings in coming 10 minutes. It's a promise by heart. This is 2017. I was practicing conventional psychiatry. I was working with a little child, 5 or 6-year-old. Repetitive negative thoughts, restlessness, nervousness. He was my friend's child. I was failing. I was not able to help him with any medication or counseling techniques. That time I felt we can't work for even our dear ones. And around 1 month after, he had fever, given amoxicillin acid. His repetitive thoughts reduced. And I was surprised, what is happening? How these repetitive thoughts are reducing? I've never read this in my literature. Some nervousness was there, but I was searching for my answers. I talked to 10 doctors in India. Why? I was not getting answers. That time, PAN's physician network helped me. Dr. Susan Sweeter, pediatric neurologist. She asked Dr. Nancy O'Hara, integrative pediatrician. She was my first mentor, and she introduced me to this sort of medicine. And after that, I started doing fellowship program in nutritional and metabolic medicine from A4M. And today, feeling blessed to be part of this intellectual group. Thank you very much, sir.
Nancy O'Hara was a part of autism.
Yeah, she was my first mentor, and she introduced me to this sort of medicine. Now I'm going to share 3 secrets of nutritional and metabolic interventions to psychosis and schizophrenia. I'm telling now and I'll repeat in between. Inflammation, methylation, biochemical individuality. I will not go to the details, I'll start with case studies. So we are repeating this inflammation, and inflammation. Definitely chronic infection and toxins, one of the causes. So this is 2018 only. My first case of medication-resistant schizophrenia. My journey started in 2017. He was on high-dose antipsychotics, benzodiazepines as usual. Many hospital admissions, nothing was working. And when we investigated for metabolic causes, raised serum aluminium was there. It was 63. And HSCRP was raised. That time, I was not aware about chelation. I was not aware about medical ozone therapy. I was not aware about HPOD. It was beginning of my journey. To be very much honest, only intentions were working. That time, I started with phase 2 detoxification support only. NAC, alpha-lipoic, glutathione, phosphatidylcholine, and in this process given low dose of minocycline also. And interestingly, without any chelation, anything, this aluminium got reduced to 24. Very simple things work. Why I am sharing this case with all of you is, simple things also work. We should love simplicity. And not only he improved in this journey, this is a 6-year-long case study. He's still in my follow-up. And beauty of this journey is, not only he's asymptomatic right now, he's starting new business in Jaipur right now. That's the beauty of this sort of medicine. This is oxidative stress in schizophrenia, an integrative approach. We have already discussed today a lot about this inflammation and oxidative stress. certainly whenever we'll try to reduce inflammation and oxidative stress, we'll get some results. I've removed these videos because Dr. Saxena wants to keep this in 10 minutes only, so these are patient perspectives. So if you want to see their perspective, you can scan this QR code and see later. So this is case study 2. 17-year-old autistic adolescent male presented with abnormal behavior, repetitive thoughts, same story, antipsychotics, benzodiazepines, nothing is working for a few years, similar things. But he was also having chronic GI issues, 7 to 8 times in a day, since childhood. Started with gluten-free, casein-free diet, started famotidine, some antibiotics initially, he improved. Then me and my physician we started medical ozone therapy along with vitamin 3C, magnesium and MAC. He improved. And again, QR code for his perspective. Remove video from this. Thank you, Dr. Saxena. Yeah, later on I can share. So secret 2, inflammation. The most important is inflammation. Second is methylation. So methylation pathways and schizophrenia. 31-year-old man with schizophrenia had been taking antipsychotics, benzodiazepines for 6 months. However, these medications were not improving his symptoms. Blood tests revealed high levels of homocysteine and insulin resistance. We work only on these 2 factors, that's it. This is prescription of a neurologist because when a previous psychiatrist was treating him, antipsychotics and benzodiazepines were not working, and it's a usual practice. We refer a patient to neurologist for the medical cause. They've gone for MRI brain. MRI brain was normal, but no one has investigated homocysteine. Just settled insulin resistance, reduced inflammation, and homocysteine, he improved. This is his prescription after his recovery. Very low dose of antipsychotic, only nutrients. This is the beauty of this kind of medicine. So this is methylation pathway. People who are not testing homocysteine or the nutrigenomics for methylation, this is the pathway. This is very much important for detoxification, hormones, and epigenetic expression of genes. And I think 60%, this is by Dr. Walsh, that methylation pathways are really important for psychiatric disorder. That's why diet is so much important for psychiatric disorders. Secret 3. So I have covered inflammation, methylation, biochemical individuality. So methylation is a little part of biochemical individuality, but I just wanted to make it crisp. Inflammation, methylation, and biochemical individuality. So we all have biochemical processes in our body from wellness to illness. Our needs are different. Similarly, the same thing is true for schizophrenic patients. They may have gene deficiency, as sir right now described, but we are just revising whatever sir has told right now. So gene deficiency, copper overload, pyrrole disorders where zinc, magnesium, B6 is required, omega-3 deficiencies, and high-dose vitamin therapies. This is niacin used in schizophrenia. So high-dose vitamin therapies have been efficacious in ameliorating around 50 genetic diseases. The diseases usually result from genetically variant enzymes with decreased affinity for vitamin-derived cofactors. And feeding high doses of vitamins raises the tissue cofactor concentrations and thereby increasing the activity of the defective enzyme. This is by Dr. Bruce Amis. And this is the article, and I really request you guys, please scan this QR code. This is a lovely article because it's not only for the schizophrenia, it's for autism, mental retardation, and many other chronic diseases. It's a very beautiful piece. So this is by Dr.
Another one by Professor Bruce James. Like, unfortunately, like any other politics, Nobel Prize is also dictated by politics. So Professor Bruce James should have been given Nobel Prize for his work. And I think researchers of this stature have done a lot of work for the nutritional interventions, and who has gone down to the core biochemistry. I don't know.
It's a lovely article. role of pyridoxine in autism, role of pyridoxine in learning disability, mental retardation, how high dose of vitamins they help in mental retardation. It's a beautiful piece. So the power of nutrients for psychiatric disorders, neurotransmitter synthesis, epigenetic regulation of gene expression, reuptake process in synapses, antioxidant production. Thank you very much. I'm open to your questions.
I just forgot to tell.
It was great actually.
Forgot to tell the outcome of LL. So what happened is that, as I said, this lady's quality of life was so poor, with no risk factor which could have been mitigating. So I'm not following her anymore. The reason being because she's fixed. So last year when I was presenting in the college congress, my practice manager called her and spoke. Now she's happily married. She works full time and has possibly lost, the diagnosis. So you can see that a tax liability has become a taxpayer, and this is the biggest turnaround which we can give to our patients,
Let me start, wait.